Next, we have Ted Chabasinski, a psychiatric survivor activist from California. Ted, as a 6-year-old foster child in New York City, was experimented on with electric shock treatment, then locked up in a state hospital till the age of 17. He has been involved with the Psychiatric Survivors Liberation Movement since 1971. Ted was one of the main organizers of the successful vote in Berkeley, California to ban shock treatment there, a campaign that received international attention. Now, as a patient rights lawyer, Ted is a past president and board member of MindFreedom International. Ted has been active in the psychiatric survivor movement for more than 4 decades. Please welcome Ted. Thank you.
I just love my sign that Dan Hazen and the other folks made up.
Microphone.
And also, I don't know if I need that. Can you all hear me all right back there? I kind of hate microphones. No?
Can't hear you.
Okay, I might learn my lesson. How's this? This a little better? Okay. Before I give my little speech, I also want to say that we all owe some gratitude to Susan Rogers, who's just done tons of good work on getting this together. In the middle of the 1930s, a young immigrant woman who worked in a garment factory named Anastasia had a breakdown and was committed to Brooklyn State Hospital in New York. Can you hear me all right? And what? And in the following year, she gave birth to a baby boy. And the year after that, soon after, she was committed again to the state hospital. And she spent the next 35 years getting insulin shock and electroshock and a whole bunch of drugs. And she died pretty young at age 63. The little boy she gave birth to was me. Anastasia Chabasinski was my mother, and I'm her son. And so, because I was the child of a schizophrenic, as you've already heard, I was grabbed by the mental health system and by the child welfare system, that needs pretty much the same thing now, since about 70 and 90% of all foster children get drugged, but I'll talk about that a little more in a minute. Anyway, I was 6 years old, and I was taken to Bellevue Hospital, and I was experimented on with electroshock by a famous child psychiatrist called Dr. Loretta Bender, who was the 1940s equivalent of Dr. Joseph Biederman now. I was given that. I was sent to Rockland State Hospital. I spent all of my childhood there till I was 17 years old, after which, being the unmedicated schizophrenic that I was, I worked my way through college. I got active in the movement. I had some responsible jobs. I finally went to law school, and I'm a lawyer now, and here I am. But in the past few weeks, I've sort of gone back into being a patient's rights advocate. I'm working for a survivor-run organization that has the contract with patient's rights advocate in a couple of counties in California. And I've been representing people at commitment hearings, including adolescents and children, and my heart's just been broken speaking to these kids. Because, I talk to them, I tell them about my own experience, and they open up to me, and they know that I'm not one of these adults that they better close off to, and I hear their stories. There was a 17-year-old boy, he reminded me of myself when I got out, and he's about to get out of the system. And he got committed because he was running around saying he wanted to kill himself. Well, of course he did. He just spent the last 7 or 8 years being bounced from institution to institution, being drugged. I spoke to a 14-year-old girl who was pregnant, who was wondering what was going to happen to her baby. I know what will happen to her baby. And again, I just felt so identified with these children. There was a 13-year-old girl. She just turned 13, just started to be a teenager. Her mother had abandoned her. Her father was beating her up. And so, naturally, of course, she was unhappy. Well, you know, I don't know what the psychiatrist would say would be the appropriate response to that. I guess you sing and dance in the streets when your parents beat you up and abandon you, right? That's the appropriate, normal way to respond. And being unhappy, that's mentally sick. And then the last one, who I couldn't really speak to very much, was this 5-year-old girl who I first came in contact with. She was in the so-called quiet room, screaming and crying and throwing her body against the wall because she had nothing. She had nobody. She was just in the system and being told basically that you're not human. I asked the staff person who was there, and I suppose this is an improvement because when I did that, so that's what I did. After my shock treatment, being thrown into Rockland State Hospital and thinking that my life was over, I used to cry and scream and throw things and throw my body against the wall. And I'd actually kind of forgotten about it. But anyway, they used to just throw me in seclusion. I suppose things have gotten better because a staff person was outside the room telling the little girl that she was manipulating people. And I asked him, why don't you just hold her and comfort her? Because that's what she's asking for. And he looked at me like I had committed, no, not like I was crazy, like I had committed some sort of blasphemy. Because psychiatry is a cult. And this guy, who probably was a halfway decent guy, the concept, he said, well, we can't do that. She's suffering from, I forget the bullshit diagnosis, reactive abandonment syndrome or something like that. Oh, yes, seriously. I mean, I'm not exaggerating the stupidity of this. And the concept of the people that are taking care of these children, that they should hold them and comfort them and treat them like real human beings, was just beyond this person because he'd been totally brainwashed by the psychiatric religion. And I just stood there, and it was all I could do to keep from crying. And I have to say that when I saw the 13-year-old, that was the last one I saw, I was crying in front of her, which probably wasn't a good idea because I don't think she could wrap her mind around that. But I'm crying now, I guess, not as much as I thought I would. So I want to say, you know, what they do to children is the worst. And some of you that I've already met have been locked up as kids, and you know what it means. You're very young, you don't have a picture of yourself yet. You need love and support to grow. It's like a human need, just like food and water. And I think everybody in this room grasps that. In fact, any decent parent grasps that. But it seems to be beyond the understanding of psychiatrists. So I want to say to those, I hope I meet more of you. Anybody who's been locked up as a kid, I'd really like to get to know you while we're here. And next year, today, the issue of the day, and it's very important, is for us to deal with a new DSM, which of course is used again. I mean, I'm an unmedicated schizophrenic. That's my label. I was told that all through my childhood. The 14-year-old was telling me how she was I'm autistic, she says. Well, you all know there is such a thing, I believe, and you all know what it means. The person can't pick up social cues. You know, they don't know how to relate to people. We were having the most marvelous conversation. She was so sensitive to what I was saying to her, so able to, okay, I'll finish this up. So anyway, next year we'll be in San Francisco. I'm going to try and focus it on the abuse of children, especially the famous Dr. Biederman, who, as I said, has taken the place of Dr. Bender. And while we're here, anybody who's been locked up as a kid, I wish you would contact me. And let's go get them this afternoon. We all have stories to tell.